special guest, Dr. Sujay Prasad, with the Distinguished Alumni Award. Albert Einstein once said, "The only source of knowledge is experience." Dear Dr. Sujay Prasad, we are very eager for you to share your experiences with us.
Honorable Chairman, Sir, Chief Executive Srinivas Murthy, Sir, beloved Principal and Dean, Madam, I'm humbled. I'm humbled to be here in front of Dr. Sujini and Dr. Ashok. They have been my mentors, and for me to stand here and talk is something extremely humbling. I would like to thank with gratitude the office bearers for giving me this opportunity to share my thoughts on this day, inaugurating the Ramaiah Medical College Alumnus Trust. It was 10 days ago, or a little more than 10 days, that I received a call on my phone from Dr. Narendranath. And he said, "Today we are having the inauguration of Ramaiah Trust." I said, "Wow, I'm going to be there." He said, "You have to come." I said, "Okay, I'll come, certainly." But then what he said next was shocking. He said, "You have to come as a chief guest." I said, that's not possible. Hey, I'm the alumnus. I'm going to come sit in the audience and listen. He said, "No, you can't, no arguments." I said, "Okay." After that call, I was only trying to understand what is it that I am being called here for. And today morning, I got a mail inviting Sujay Prasad for the Ramaiah Trust. And in that, it mentioned that Sujay, through his organization, has done a lot for COVID. When Dr. Narendranath mentioned so many things, he raised the bar. But for me, I think it is just our duty. Whether we were the first one in Karnataka or the third one in India, it doesn't matter. But what matters is how we went about doing what we did for the benefit of our countrymen, our state population. And I think that is the key for me. There have been many anecdotes that I can share, and some of them I would want to share here. When I joined in 1984, the landscape is very different. It's simply so different. It's beautiful now, and it was even more beautiful then, without a doubt. I can tell you it was rustic. It was beautiful. It was all the manicured lawns and all of those were not there. It was constructions were going on. A lot of stones. Constructions were going on. And believe me, friends and we're all in front of the physiology department, one at the ground floor. We would stand there, finish our work, and we would get a rare glimpse of our founder, Sri M.S. Ramaiah. And at that age, I would wonder, such a man has achieved so much in life, and he was supervising the constructions that were going on. The old library block, the college hospital. It was amazing. At that point in time, it did not occur to me the amount of passion and commitment that he had. But looking back now, I can imagine the involvement he had in bringing together all of this in the vision that he had. And we are all sitting here thanks to him and Honorable Chairman, sir. I think they need a round. I think there's a distinct difference between education and training. Training is what and how we do some activity, but education is why we do that. And believe me, I've come out of this college knowing that why. And I don't know the why of everything, but I ask this question to myself, why am I doing what I'm doing? And I get the answer. And all of this comes out of the great teachings and the great teachers we have had and we are having even today. Madam herself was my favorite teacher. Dr. Nalini Kilara and Madam were there. And I'll quote one instance. I don't know how relevant it is, but I'll quote the instance. Dr. Naresh Prasad, who's an orthopedic surgeon, well-settled orthopedic surgeon in Hyderabad, and myself studied together. And it was in our fourth year, that there was an internal exam in medicine, and the topic and the system was renal system. And the two of us had studied extremely well, and we studied all possible approaches to the questions that would probably come. And as luck would have it, we got the same questions for which we had prepared extremely well. And both of us wrote the answers in a way that the order in which the points were mentioned were the same. So when the answer papers were corrected by Madam and Dr. Nalini Kilara, there was a suspicion. Both of us were called. Said, did you guys copy? I said, no, madam, we studied together. We were fortunate that the questions that came were so much in line with what we knew, and physically we were far apart. But they were such good mentors that meaning, like I said, we know the why, or at least to ask the question why. Why do we do what we do? And when we look back and see what have we taken from this institute, I think it's far more than just medical skill. It is the foundation of being good humans. That is what we have seen our teachers standing next to the patient, the bedside manners, the way they behave around the patient. That is what we learned, and that is what we have stood for. We become the same persons who propagate this kind of behavior and standard of education, probably standard of care, as we go out into the world. When we started doing the COVID testing, there was so many obstacles. The obstacles started with human staff, manpower, isn't it? We had staff who would worry for their family that they will get COVID and they will in turn give it to their family members. And that was a big concern. So we ensured that all safety precautions, including staying in the lab itself and not traveling back to their family members, was a means for them to do the testing part for us. The instrumentation, everything was scaled up to the extent that we could do at 5,000 tests per day on any given day. This was through 24 hours and ensure. So for me, quantity does not matter. Quality matters. Are we able to give results that are without errors? And I can tell you even today, but we cannot be 100% perfect. We have had issues. The uploading to the ICMR portals there have been issues. So we only focus on how we minimize the errors that we see. So there are many memories that I take from here. And when Madam told possibilities of what we can give back. I think I stand here, I stand committed. I'm there, and I'm only looking forward to the office bearers to give me some work. Okay. With this, I may be physically outside of Ramaiah physical space, but nobody can take the Ramaiah of me. It's amazing to have that feeling and the sense of belonging, whether we are physically present here or in the US, Europe, wherever we are. I think it's been amazing. Thank you very much.